One of my favorite things as a healthcare provider for fertility patients is actually working with patients to go over all of the additional measures that can be implemented to support their fertility treatment outcomes that are rarely discussed. And diet and lifestyle, for some reason, are still not a central component in the advice that's given to patients that are going for fertility treatments. And I want to share with you the results of a brand new study specific for patients that have polycystic ovarian syndrome. So I find this of great interest because it actually covers a fruit that I think is a South Asian favorite. It's pomegranates. And so pomegranate juice has actually been studied for various cardiometabolic diseases. Like there's some studies looking at it for the management of hypertension or oxidative stress. So I thought it was really exciting, this crossroads where we're looking at pomegranates specifically for PCOS. With polycystic ovarian syndrome, there's a lot of pathophysiological driving factors that can lead to the symptoms that are hallmark for PCOS. And one of those issues that we often see is actually cardiometabolic issues, so increased inflammation, increased oxidative stress. And so they looked at the use of concentrated pomegranate juice, specifically for patients with PCOS, and they found that compared to control subjects that didn't consume any of the concentrated pomegranate juice, they actually saw a significant decrease in serum testosterone levels. Now, this is actually very interesting and very important because elevated androgens, testosterone in particular, can actually drive a lot of the issues we see with PCOS as well. It can lead to hirsutism, it can contribute to insulin resistance in the ovary, it can contribute to a higher risk of miscarriage or lower implantation rates potentially. So we see that managing hyperandrogenism or this elevated testosterone level for PCOS is actually very important and crucial. So pomegranate juice, while it unfortunately didn't show any reduction in oxidative stress markers or inflammation in this particular study, they saw a decrease in serum testosterone levels. And now this isn't the only thing that we would cover for patients that have PCOS, but it could be an interesting add-on for patients that do have hyperandrogenism. And in other studies, they've actually found that pomegranate juice may have an impact in supporting uterine lining health. And one of the other issues we can sometimes see with PCOS is actually a thin uterine lining. So if you are going through infertility treatments, if you do have PCOS, talk to your healthcare provider, ask them, what are the dietary changes, lifestyle modifications, what are the foods, simple food things that I can include to help with my treatment. And there are a lot of studies on these topics, but they're often not discussed during a consultation. And it's hard to include all this conversation when sometimes you only have 4 or 5 minutes with a healthcare provider.